Michael Moore SICKO brought single-payer health insurance to the forefront of America's consciousness. The movie and its proponents contend that single-payer insurance would ensure that all Americans would have access to high-quality health care, that the quality of health care would be superior, and that the cost would be lower. But is all of that really true? What are the facts? Close examination of existing single-payer systems shows that everyone might have a base level of coverage, but they don't necessarily have access to care. While everything is free in a single-payer health delivery system, often very little is readily available. Access to the newest technologies and drug therapies is often limited, and there are often significant wait times for any extensive level of care. For example, the British typically wait 25 weeks for routine tests critical to cancer and cardiac care, or just to get an MRI. Beth Ashmore's mother traveled to England, became ill, and then experienced firsthand the workings of an established single-payer healthcare system.
My mother, who was a music professor at the University of Oklahoma, every summer took a group of kids to tour England as part of their curriculum and music experience and perform overseas. And while overseas, she became very sick on this tour. And once the tour was about to be over, she had, over the number of years, a number of friends that were in the London area and wound up going to one of her friends' home. And interestingly, this was outside of London somewhat, and she had a doctor make a house call, which we don't see that much of anymore in this country. But the physician came and just made a determination that it was pretty much the flu. And over the course of probably 36 to 48 hours, Mother was gravely ill very rapidly. And her friend finally took her to a rural hospital facility that was north of London to see what they could do to diagnose the problem. Many, many years ago, probably when Mother was 40 or 45, she had an abdominal tumor that came and went, and it was non-malignant. So I knew that these kinds of things were possible from a family history standpoint. And when she was sent to this rural facility, the doctors just pressed on her stomach, from what I understand, did not do a biopsy, and basically indicated that she had cancer and tumors in her abdominal area. Well, having known that we had been through that before, that kind of diagnosis wasn't going to hunt with me, because I knew very clearly that there were possibilities of having that problem without it necessarily being cancer. And so because they did not and could not do a biopsy, the tumors apparently were so big and so many of them that they were shutting down her kidneys. And at that point in time, they were beginning to just talk very pragmatically about not really having much that they could do about the situation. Interestingly enough, and probably the most surreal part of the whole experience, is the phone call I had at 3 o'clock in the morning with the physician that had oversight of her care, who explained to me quite bluntly, "I'm sorry, we can't do dialysis on her. She is over the age of 55. That obviously was such a shock. I really did not know how to react to that kind of news.
Proponents of single-payer health care contend that the outcomes are better. But do the facts support that claim? A November 2006 survey in Great Britain revealed that over half of the respondents rated the NHS worse than in 1996. And a Canadian Supreme Court ruling in June of 2005 stated that the government is failing to deliver health care in a reasonable manner, thereby increasing the risk of complications and death.
We started making phone calls. I made calls to her physicians in the States. We had the American Embassy on the phone, and in a matter of just a few hours, we were finally able to convince the British physicians in the British system over there that she should not be applicable to these kinds of laws and regulations because she was not a British citizen. The challenge is when you get into remaining hours and the time that it takes in order to react to a situation. By this point in time, one kidney had already shut down and the other was beginning to shut down. So they finally relinquished that fact and decide to move her to another facility and start dialysis on the remaining kidney. And I got Blue Cross Blue Shield of Oklahoma on the phone, and in a matter of 4 hours, they had approved and made arrangements for a medevac jet that can basically do anything other than open heart surgery to leave from Atlanta, Georgia, to go straight to London Heathrow Airport and pick her up and bring her home. So the jet company in Atlanta was making attempts to find Mother so that they could make the connection and get her home. And they couldn't find her. She was lost in the system. And so the rest, unfortunately, is history. She just did not make it. She died by herself in the corner of a ward on dialysis where they gave her morphine and kept her comfortable.
Finally, is single-payer health care really less costly than private market health care? Single-payer systems attempt to limit cost by regulating the supply of medical services. In other words, by rationing treatment and technology. Even with this limited access to responsive care and modern technology, Canadians are paying 40% more taxes and Europeans are paying 60% more than Americans.
But the reality is, when you work with global budgets, no matter who's writing the check and paying the claims, there's going to have to be limits. And we've reached levels of expectations of care and incredible miracles in this country that folks don't truly understand that a lot of that will go away when we start putting caps on budgets. That's the reality.
Many Americans are frustrated with the high cost of health care and are looking for solutions. But Americans don't want to sacrifice quick access to state-of-the-art health care. They just want to pay less for it. While there's no obvious solution to lowering the high cost of health care in America, one thing does seem clear. Single-payer health insurance is not the answer.
I think it's important to understand my passion on this issue comes from the fact that I have a father, a daughter, and a grandson that are here because of the miracles we're able to do in this country, and a mother that is not here because other areas of the world don't share those same miracles. I want us to remain strong and understand that this fight is not just right now, today in 2008. It's for the next 20 years. It's for our kids. It's for our grandkids.